uptake inhibitor, but it actually targets and blocks some serotonin receptors. But remember how many serotonin receptors did I tell you there are? 9, right? So it targets receptors that are not responsible for behavior. Now, trazodone has a nice short half-life. It's something that can be used immediately, and it is being used probably much more commonly now than clomipramine, even fluoxetine, because of its immediate effects. And it's primarily being used to treat anxiety. And the best place it's being used are in critical care patients that are very anxious. But now I'm seeing it used for motion sickness or hospital visits, vet visits. I think it's probably one of the more common drugs now that's being used to treat animals that are anxious when they go to visit veterinarians. I'm seeing it used to treat long car trips now. Motion sickness, anxiousness, not motion sickness, but anxiousness associated with car trips. So trazodone rapidly is becoming a very popular behavior modifying drug for treating anxiousness. And it's not been well studied in dogs. It's got a relatively short half-life, but it's largely being used anecdotally. Okay. The last group of drugs, and I think there's just 2 slides, are the monoamine oxidase inhibitors. So monoamine oxidases are things like catecholamine, dopamine, norepinephrine. They are metabolized by monoamine oxidases, which is located in the neuron. And so when we're using the inhibitors, what we're doing is we're preventing the metabolism of these catecholamines. Now there are 2 types of enzymes. There are monoamine oxidase of the type A, and they target serotonin. Type B targets dopamine. The drug that we're talking about, deprenyl, and it has actually 2 non-proprietary names, deprenyl or salicyline, anapril is the veterinary trade name. But the ones that we're going to be using are going to target type B monoamine oxidases, and that means dopamine. So we don't use these drugs for general behavior modification. In fact, we're going to try and avoid using drugs that target serotonin because of an increased risk of toxicity. So this is too much serotonin here. So it turns out that dopamine deficiency is characteristic of many senile dementias, and that includes cognitive dysfunctions that are associated with very, very aged animals. They're people as well. This drug is approved for use in people as well. So it's a very finite population that you're going to be using this on. And the example I'm going to use is my 19-year-old cat. When she turned 17, she started wandering the halls at night carrying around caps to bottles and just yowling. She definitely lost her cognitive abilities. And so she would be a good example of an animal that might benefit from something like salicyline. So the one thing I'm going to be careful to warn you of is do not use them with reckless abandonment, because it turns out that this drug is actually metabolized to methamphetamine, which may be part of the reason that we're seeing increased activity in some of these animals. So it does influence a whole host of CNS things potentially because of this effect, but this drug is pretty useful and very limited in its behavior modification. There aren't many side effects associated with the drug, so I didn't even bother putting them down. The main thing I want you to know is it's available for treating cognitive dysfunctions. So this last slide here, as we wrap up, if you can't read it, then pull it out and blow it up. But I put it in here, it's a human drug, and I put it in here so that you could kind of place where everything shows up. Here are the tricyclic antidepressants over here. Here are the selective serotonin reuptake inhibitors. Then over here we have miscellaneous drugs. For those of you that know buspirone, or here's mirtazapine, which we use for appetite stimulation. So this is actually for future use, not for now. And the main reason I put it in here is because there's another class that's emerging, and these are called the selective serotonin norepinephrine reuptake inhibitors, and they are now being used for behavior modification. I'm guessing that we're probably going to see them used in animals. Tramadol, as an aside, probably would fit under here because tramadol targets serotonin and tramadol targets norepinephrine. We don't think about it as that. We think about it as an analgesic. So this is primarily for your edification, just so you can see the complex order or the complex disorder of behavior modifying drugs. Okay, any questions? That's it. We got through it all. Right on time. Okay, all right. So you owe me a homework for next Monday, and then I'll see you Monday. Oh, no,
We have a
Thursday.
test next Monday, don't we?
Do you have a test next Monday?
No, Monday.
Yeah.
Yes, it's next
Next
Monday. We have a test next Monday.
Did Dr. Judd, but I'm not on this test,
No,
I
I think he's gonna be. Yes, you are.
Yeah, this is.
I'm okay with it, not this.
This
it's not
is-
a test, but-
Tim, where did Dr. Judd tell you this exam ended here?
Here.
Does it include anticonvulsants? Okay, all right, so, you will have, let me see if he's gonna include the behavior modifying drugs or if it's just adverse events, so I'll follow up. Thursday, health session, yes or no?
Yes.
See you Thursday.
I will never say no.
We'll never say